Hello, and welcome to another edition of Academic Matters. I'm Joe Marbach, the Provost at LaSalle University. In this segment, I'm joined by Dr. David Falcone, who's a professor in our Department of Psychology. Dave, welcome to the program.
It's good to be here, Joe. Good to be here.
Dave, tell me a little bit about your background and your history here at LaSalle. You've been here for many, many years.
Yes.
And what keeps you here in a sense, besides the paycheck? Because
right. Let's see. I arrived here in 1980, so I'll let you do the math. I'm a firm believer in the liberal arts platform for education, and LaSalle has been, and with its own historical struggles in terms of what the sociocultural context requires of an education, I think has been relatively true to that liberal arts agenda. And that's what keeps me here, in addition to the fact that it is work, it's a job, and there is a paycheck, and so on.
Okay. Now, you're in psychology.
You're
it's
right.
one of our larger programs. Gets
Yeah,
lots of students.
Yeah.
Let me ask you to do a little comparison. You said students of the 80s versus students of the 20 teens. What do you see different? And again, it comes back to your notion of LaSalle remaining true to its mission, but dealing with a different type of student, I think.
Yeah, well, that does play into what I meant when I talked about the conditions. A university doesn't exist isolated from its surroundings. So regardless of what on the inside we organize as our agenda for students in terms of education, there's also a tension with what is being required from the outside environment. We live in a culture now where a good example for it would be that when I was 18, I could think about what I wanted to do with my life. I could turn to somebody and say, I want to get an education, I want to go to graduate school, I want to get married, I want to, and so on. Mm-hmm. And it was likely that if you could do that. Today, an 18-year-old can't locate themselves in that story. It's that their professional lives will ricochet off of numerous kinds of possibilities over a lifetime. There's much more labor that's casualized, that instead of hiring people and having them be part of your industry, you bring in people for the time that you need them, and so on. So the student of 1980, or the student back in the 1980s, and the students now have been conditioned incredibly different to what their lives are about. I mean, just the technology that is part of the lives of students today, it just changes the context of what every day is about relative to the 80s. Now, I teach statistics, so if I was teaching someone about analysis of variance in 1980, what I said or what I might have been delivering is pretty much the same as today, because analysis of variance is analysis of variance.
Mm-hmm. The concepts don't change.
In statistics.
Yeah.
But if you were to videotape my classroom then and now, while the words sums of squares divided by n minus 1 don't change, they have changed incredibly. So the whole interaction, the dance, is just much, much different.
Is it, you can elaborate on that change. Is it that attention spans are different? We always hear of professors that pine for the good old days. Students were better or more equipped. Is it attention span, technology? Is it expectations that are different?
Let me address a couple things there. Mm-hmm. First of all, the good old days were never the good old days, so we should start from that. We all reconstruct for ourselves what our past was about and pull from it what we do. Whatever our pains and pleasures were back then We have different ones now, but there were things that worked and things that didn't, and things that work now and things that don't. So it isn't about trying to make sense of what we had and lost, or something like that. It's about just differences. And the students today, and the second thing I want to say before I actually get to that is that this isn't about something wrong with the students, okay? Because it's real easy to fall into this thing about, well, once upon a time they had, for example, a better attention span. That may be a difference. You know, maybe surviving in today's world, having loyalties or commitments, and those were unfortunate choices, but some literature talks about this, that in today's world, to get too committed or become too loyal to something may ultimately not be, say in the workforce, may not be an advantage if you're only going to be there a short time. So I don't know how to value those things. All I can say is there's a difference.
There's a difference, okay.
And the difference requires a teacher to tune into those things in order to try to attain or to succeed at what we're doing. And I'll add one other thing, I suppose, since we're here. It's you know, there's a writer that talks about the tragic view of education, and what's referred to is that, in a sense, we have to fail. That education, and I mean at the level of the classroom, that when you think about what we're trying to do, it is so complicated. It's so nuanced. There are so many lives that are being touched from so many different places. It has to fail. And our task as a teacher is somehow to try to find an optimism in engaging that. Never let that destroy you or burn you out, or I think Beckett, you try, you fail, you try, you fail better. You know, it's that. So somewhere in all of that is the answer to the question that there is a difference, and but I can't articulate it as their attention
They're
spans
this or they're that.
It's
just
it's definitely there, though.
Well, let me go in a different direction where you might be able to identify it more specifically. You're doing statistics, and that's kind of always the same, you know.
Right.
But what about changes in the discipline of psychology itself?
Right.
You know, and our program has grown, and you know, we have a master's program, and we've had accrediting bodies in. So I had a great education this week. The difference between counseling and therapy and psychology itself, and we have a doctoral program. Are these relatively new developments? How are they emerging from your perspective?
Now, about the field itself, it's an exciting time to be in psychology and related fields, and you're right. What started out, for example, in our program as a psychology-based program during the period that back in 1986, 87, it was called Human Services Psychology. Well, in the interim, other areas like marriage and family therapy and counseling and so on have emerged into their own entities, and again, in the normal struggle for a presence, we find ways of differentiating ourselves from each other, and at the same time trying to find ways to coordinate our efforts. And I think one of the things I could say about our department, and I hope someone else can say this as well, but in the time that we've gone from an undergraduate program through a master's program into the doctoral program, and another doctoral program I think is being considered at the moment, there has been a real attempt to balance, to allow that differentiation, but at the same time cross-fertilize. So for example, I'm not a counselor, but I teach in the counseling program because I teach statistics, because there's something to share. But on the other hand, I had to retrain because when the accrediting agencies made clear what they wanted to occur in those courses, there were things that as a psychologist I may not have been trained in.
Mm-hmm.
So a lot of learning, a lot of learning.
And in my conversations with some of these folks from the accrediting body, they actually were very complimentary about the way in which our therapists and our counselors work together.
Oh, good.
In ways that where there may be tension in the disciplines, it doesn't exist in the university, that we can complement each other and use that approach moving forward.
Well, people have worked at that, so that's good to hear, because that implies something's working.
That's great. We've got about 2 minutes left. Dave, where's it headed? Are we going to continue with this segmentation in the discipline, or is there going to be a grand unifying theory? Are we going to come back to that?
Well, I don't think we'll ever have a grand unifying theory. I don't think we have a law yet, let alone a grand unifying theory. But I do think the pendulum, and that's an interesting question to ask at this point, because the Human Services Psychology program back in 1986, as our founding master's context, brought all the disciplines of counseling and psychology together and put them under one title.
Mm-hmm.
And over the years, it's differentiated. And I think the time has come where the differentiations there are papers being written now by people in these fields saying, wait a minute, we do what they do, and they do what we do, and we should be coming back together. And it will probably come full circle, but the circle will have risen to a different level, so it'll be a good thing.
Okay, so we're learning from each other as we move forward.
Yeah, absolutely.
Dave, we've got less than a minute. If anybody watching is interested in the psychology program, or they want to contact you, they want to bone up on their stats.
Right.
How's the best way to contact you or the department?
Well, actually, since I'm here, I will act as the bridge. The best way to contact me, falcone@lasalle.edu, and let me know who you are and what you're interested in, and if I can't answer the question, I'll be glad to point you in the right direction.
Thanks, Dave. My guest has been Dr. David Falcone, a professor in our Department of Psychology. Please stay tuned when I'll be joined by Dr. Patricia Dillon, who is in our Department of Nursing.
In LaSalle University's Communication Department, students learn to think and do.
Every semester, communication students create and implement public relations plans for local nonprofit organizations.
And journalism students produce Germantown Beat, an online news source for the local community.
It's great that we can apply what we learn in the classroom in our community.
Philadelphia is the nation's 4th largest media market and has 4 major sports teams.
Being in a major media market allows us to gain great professional experience through internships and co-ops.
The Communication Center is home to the university's cable station.
LaSalle TV reaches over 350,000 homes in Philadelphia and airs mostly student-produced programming.
Our communication department is ranked in the top 10 in North America for relational communication research.
But keeping with the tradition of the De La Salle Christian Brothers, teaching students comes first.
Think, do, with LaSalle Communication. Check us out on Facebook and Twitter.
Welcome back to Academic Matters. I'm Joe Marbach, the Provost at LaSalle University. In this segment, I'm joined by Dr. Pat Dillon, who's a professor of nursing in our School of Nursing and Health Sciences. Pat, welcome.
Thank you. Thank you for having me.
You're welcome. Pat, give me a little bit of your background. What got you into nursing in the first place, and then what got you here to LaSalle?
I think I always wanted to be a nurse. That was always my aspiration as I was growing up. And I've been a nurse for more than 40 years. I was very young when I graduated. I've been in education, nursing education, for more than 30 years. And I've always practiced, which I have felt is really important to do because theory and practice go hand in hand. So that my clinical practice informs my teaching.
Mm-hmm.
I love to tell stories when I teach and give a context to the material that I'm covering, and the stories really bring the material alive for the students. And oftentimes they'll tell me they remember things because they remember from the stories that I tell them.
So you're able to say, I dealt with a patient,
sure.
And we were doing this exact same procedure, test,
exactly.
whatever.
And it really provides a context for them. So the two really go hand in hand.
Yeah. And that's also very LaSallian, in kind of we take a liberal arts basis, but there's a practical component to what we want students to be able to take out of their education.
Right, and that's one of the reasons that I was drawn to LaSalle, was that your mission and your emphasis on teaching and the student-focused education is what led me here. That's what I feel our priority should be. We're here to help the student learn. That's my job, and so working together with the student, then we're able to hopefully achieve that.
Yeah, and it's the type of students that we are educating continues to change and develop. You're directing our RN to BSN program, which is online. So that's generally, I guess, adult learners coming back to get the bachelor's degree. But you've got traditional students in the classroom as well.
Right.
Is that typical of nursing programs, or is anything unique to LaSalle, or is that just where the field is headed?
That's where the field is heading in terms of online programs for the RN to BSN. The graduate program is a mix of, we have the advantage of offering both face-to-face plus online programs, or some of the courses are online. So it does meet the needs of the working student and those students that have different learning styles, whether it's they prefer the face-to-face or they prefer the online. The online gives them the flexibility so that they can continue to work and in their practice while going to school.
Okay. Now, for folks at home, they'll hear nursing and what's going on in the School of Nursing, but the field is really developing, and it's becoming an emerging field in its of its own right. And we offer a degree, Doctor of Nursing Practice, which is more clinically based, but there's also theoretical elements of nursing and what it means. Tell us a little bit about how that's developing and where you see that headed.
Healthcare is obviously changing, and nursing will definitely have a big role in it. The emphasis is now in primary care and health promotion. So we should see changes in that and more involvement in students in the community and public health nursing. And acute care still will be in existence, but again, the emphasis may change. But it's calling for nurses to be well-educated, well-prepared to handle the healthcare needs of our patient population.
So Pat, does that mean there's going to be a continued demand, an even greater demand for nurses moving forward?
Definitely. There will definitely be a demand for nurses because the nursing population that exists now is getting older, and sooner or later we do have to retire. So there will be a need not only for nurses in the practice arena, but also for nurse educators because faculty are also aging, and so that definitely will be a need.
Well, as you very well know, there's a tremendous need for nurse educators now. It's one of the issues that many schools are facing, LaSalle among them. How do we find qualified nurse educators to teach the next generation? Because it is an emerging field, and it needs to get that kind of attention and direction from in terms of the leadership within the field.
It has been difficult, for sure. I think that there are incentives now and scholarships that are becoming more available to students, prospective students that want to pursue nursing education. So that if they are available, then that might increase the working force in nursing education down the road. So hopefully that will happen.
Right, and we see again increased attention to the profession, magnet status.
Right.
I hear commercials all the time. This hospital has achieved magnet status, but it's all about the training of nursing.
Absolutely. And education in nursing has absolutely changed too. As I said, theory and clinical go hand in hand. My dissertation focused on that specific aspect of it and how the impact of clinical affects the students, their cognitive and their competence and their confidence development during their education. So with that, I've expanded that to look at simulation. So simulation has become a big part in nursing education. And the other thing that has become extremely important in education is interprofessional education. So that this is something that we will be seeing more of. It's an expectation of graduates in healthcare when they are out working in hospitals or in the community, that they work together in teams. But there is little done during the educational process for them to experience that. So we're seeing changes now in curriculums that provide them the opportunities to work with other disciplines that will prepare them to work as healthcare team members. And we had one such event yesterday. We had the interprofessional education event that focused on the healthcare needs of veterans. And so what we had, one of our former students who served in Iraq as a nurse anesthetist presented, and she also brought a fellow Marine that was wounded in Iraq who she attended to. He also came to present, and a VA representative also spoke to the healthcare needs of the veterans. They were featured on 60 Minutes in a short clip called Fighting Chance. So it was a very powerful and moving event for the students yesterday, and well represented by the different disciplines. So we had nursing, nutrition, speech, social work, public health, I think we had, and psychology.
Okay,
so there were many students from very varied disciplines, and it was a well worthwhile event.
So this interpersonal approach it's really a team approach.
Absolutely.
Dealing with the needs of the whole person.
Right. So it's the focus is patient-centered care. And what members of the team do you need to provide the patient being central to that patient-centered care. The most important member of that healthcare team. And then what disciplines do you need to help meet those needs of that patient?
So if somebody's like a veteran, they might have psychological problems from their experience, but then you also want to make sure they're getting the proper nutrition.
Right, absolutely.
The right
so the veteran
environment.
that came to speak had a traumatic brain injury, and he also was an amputee.
Okay.
So it was
he needed physical
right,
therapy,
physical therapy. He
occupational
needed
therapy,
speech because he lost part of his tongue, he lost part of his brain, so he needed physical therapy. He needed speech, nutrition, every social work, nursing, psychology, all of medicine, all of those different disciplines were very important in terms of getting him to where he is today.
And my understanding is that nurses work in teams. Like that's how you're trained. So is this kind of second nature to nursing, or is it got to be just teased out more thoroughly?
We do, but the healthcare system has been very hierarchical, and medicine on top. So that team approach wasn't always in existence. So, but the reality now is that is the best way to go in planning care for patients.
Okay, and we'll see this. How does this manifest in our curriculum?
So we're incorporating interprofessional experiences for the students. It's my hope that down the road we can develop an interprofessional health and wellness center for faculty to practice, students to have clinical experience, and we serve the communities. And in doing all of these things, we will be living the mission of LaSalle.
Okay, so in a sense then, how are schools situated? Because we have nursing, public health, nutrition, speech language, a couple of those areas that you talked about contributing. And I know there's a lot of cooperation on the arts and sciences, social work, psychology as part of this. So an interdisciplinary center pulling these folks together.
Absolutely.
Okay.
So that's my vision down the road.
Well, it's a great vision to have. Pat, if folks are interested in the programs, where would they get a sense of what we do offer? Is it best to go to the website? How do they
Probably the
contact
website
you?
is the best, but they certainly can feel free to call me or to email me, and I will definitely get back to them.
Okay, so that's, is that Dylan at?
Dylan P.
At
LaSalle.edu.
LaSalle.edu.
Yes.
Or our website,
Right.
which is www.lasalle.edu.
Right.
So, and then /nursing or something along that lines. All right. Well, Pat, thank you for being on the program.
Thank you.
Okay. Once again, my name's Joe Marbach. I'm the provost here at LaSalle University. You've been watching Academic Matters. Thank you for watching, and check us again next week.